So it was traditionally thought that bleeding disorders occurs only in men or boys because the most common bleeding disorders, hemophilia A and hemophilia B, are X-linked disorders which were diagnosed in men initially. So for a long time people thought that women do not bleed. But over the years we have realized that women too bleed. So especially women with von Willebrand disease, which is one of the commonest bleeding disorders, is very under recognized because these women do not report to a hospital commonly for their symptoms. Then there are women with rare bleeding disorders, women with factor 13 deficiency, factor 10 deficiency, factor 5 deficiency, etc. These are autosomal recessively disorders which affect men and women equally. So women can bleed with these disorders as well. And then you have a group of disorders called platelet function disorders like Glanzmann's thrombocythemia, again which can affect women, and also who are carriers of hemophilia. Again, women with hemophilia carrier state, as in women who are carrying the hemophilia genotype, were thought not to bleed. But then researchers have found that even these carrier women can have bleeding symptoms. So now they are labeled as girls and women with hemophilia, and a factor level is checked in them as well. Any girl or any woman who is presenting with recurrent bruising, presenting with epistaxis, that is frequent nosebleeds, presenting with gum bleeding, as in either bleeding while brushing teeth or spontaneous gum bleeding, presenting with bruising, small trauma, they are presenting with bluish patches on their skin. When there is a cut, they are having prolonged bleeding. If they have prolonged menorrhagia, so heavy menstrual bleeding again is a condition which has a lot of stigma around it, and when these disorders affect women, since they are genetic, many of the other women in the family like mothers or sisters will also have a similar phenotype. So often heavy menstrual bleeding is thought to be normal for that family and these women never report. So if a woman is having heavy menstrual periods which is requiring repeated, as in you have to go to a gynecologist because of that, whenever you are having a heavy menstrual bleeding, it's lasting for more than 7 days, it's causing severe bleeding, number of pads which have to be changed is more than 5 to 6 in a day. When you stand up from a sitting position, there is a gushing of blood, there are clots being passed. These are all symptoms where women with these kind of disorders are labeled as heavy menstrual bleeders and they should be reporting to a hospital. Also, if women with menstrual bleeding, if they are diagnosed to have anemia or if they are requiring blood transfusions because they are losing so much of blood in their menstrual period, then again they need to be evaluated. Other than this, a small percentage of women can also have deep bleeds like joint bleeds, muscle bleeds. They can have bleeds in their brain, they can have bleeds from the urine, etc. So these are common to men and women, but for women specifically, heavy menstrual bleeding is a major symptom. Yes, I think recognition is crucial. It's easier, I would say, to diagnose a bleeding disorder in a man because these disorders have been, the awareness regarding these disorders have improved over the years. But for a woman with a bleeding disorder, the awareness has to start from the primary care physician. It has to in fact start from the home. So in a home scenario, they should know that this is a symptom which requires a medical help. So it should not be thought of as normal and just hidden under the carpet. They should actually seek medical help. That's one. The primary care physician, the gynecologist or the pediatrician who is seeing the girl with bleeding or a woman with bleeding should know that these disorders exist and they should come and get a child diagnosed. Once diagnosed, the treatment I would say is similar. So it's usually depending on what is deficient. So if it's fibrinogen deficient, you give fibrinogen concentrates. If it's von Willebrand factor which is deficient, we would give concentrates. So that part is similar. We would also emphasize for women bleeders who have heavy menstrual bleeding to take iron daily, and as well as sometimes to go on oral hormone supplements so that you can reduce the menstrual bleeding significantly, thus reducing the need for factor support as well. So whenever we have a patient who is diagnosed as hemophilia A or hemophilia B, it is estimated that there will be 3 to 5 women in the same family who will be genotype positive. So it could be the mother, it could be his sister, it could be his mother's sister and mother's sister's children. So if you look at the extended family, if you do a carrier screening, it is estimated that 3 to 5 carrier women will be identified. It's very, very important from both the standpoint of the carrier as well as from a standpoint of diagnosing the next, as in the whenever there is a pregnancy for any of these women, to diagnose whether the baby is affected or not. So it is extremely important for women in the family of a hemophilic boy or a man to undergo carrier detection, and preferably it should be done before the time of marriage. So before, I would say during early puberty, so that you would be able to manage if it's a genotype positive girl or a carrier girl, we would be able to manage her bleeding also properly.